Amy Stevens, Goodman Way Vet Surgery, and my supervisor is Prue Chambers. So I'm doing bandaging of a jugular wound in here. It's a common injury that we see out here with the pig and boys because they have a chest guard on with a neck guard, and this is the sort of only exposed area, and quite often a nurse might be the first one on the scene. So getting a swab which isn't too big, so it doesn't act as a sponge.
And then what do you do with the swab?
So pressing it firmly into where it's bleeding.
Yep.
With your thumb in there, put the bandage underneath and thumb back in to where it is bleeding.
Yep.
So I'm just going to go around once and then over. So using the ears as an anchor point.
Mm-hmm. Not helpful, Fairbear.
No, moving a lot. So again, using this ear. Making sure that the bandage isn't too tight, because we don't want to constrict the dog's airway.
If it was to bleed through?
If it was to bleed through, another bandage on top, don't take off the old one.
Yep. And our normal bandage is what we would use straight up for?
Would be the Tensoplast.
Yep.
It's sticky, it stays on better when they move.
Yep.
So if this dog is in hospital, you'd be checking it all the time to make sure that it's not crippling too much under here, because if it does, that's their throat.
Yep.
Not pushing too far back here. If you had to use a normal bandage, you would go with Tensoplast around the edges,
yep,
just to hold it in place. So removing this one.
So once you've stopped the bleeding,
yep,
what is our next point of call? Like, what will we?
Once you stop the bleeding, the vet, if the vet wasn't here, someone would have already notified her, another nurse or something like that. You would then put a IV line in the cephalic vein.
Yep.
If there's any wounds on the legs, pick a leg that is less affected.
Yep.
And if so, bandaging that up with your conforming and Tensoplast.
Yep.
If we had a jugular wound that was down here more and we were crossing over the shoulders and under here,
yep,
we would bandage the whole legs.
And why would we do that?
To help with the blood flow and circulation, because you don't want something tight here and then not here, you'll end up with a lot of swelling.
Beautiful.
Okay, so once we've bandaged and we've got IV access into the vein,
yep,
what we would do is we would put a bung in that catheter and take the catheter in but not the bung. That way, if something was to happen and we need to go on fluids straight away, we already have the access, we just have to hook them up. And then we would do a clinical exam. So checking your skin tinting, checking the gum colour. Now this dog has darker pigment, but you can see there's a nice pink in there. So 1 to 2 second capillary refill time. Nice and moist. Check inside the ears and the eyes. Gently. Yep. And checking temperature.
Yep. And the other thing that we then do once we've established the dog on, yep, is stable.
So once the dog is stable, we would then make up a bed and make her comfortable. With extreme blood loss, she may be feeling very cold and shaky, so get her comfortable with some hot water bottle, try and get that temperature up,
yep,
possibly some foil blankets, and then the vet makes a plan and we go with that.
Yep. And what's the other thing we establish with the client?
So speak to the client with regards to how they want to treat and all of that. Say if they wanted to have surgery and have this wound stitched up, or in hospital with bandaging, all of that. See what the client would require. So after that, you would mark on a case sheet an estimation of blood loss since they've been here, and speak to the client with how much blood has been lost in the trip here or when it happened. Noting that obviously a little bit of blood does look like a lot, but gauge how much maybe on the back of their ute, whether they mention it's a bucket full or something like that. So you can take into account how much blood the dog has lost compared to how much that it has, and whether it may require a blood transfusion. Go through the history and see as best you can if that dog's ever had one before. That way you have that information ready for the vet if needed, so that she can proceed with a blood transfusion.
Okay.
Okay, so once decided that we're going to put the dog into hospital, go out, get the client to do a consent form, and then one nurse will stay with the dog at that time, because a lot of dogs, sometimes they might get a bit stressed out or distraught when the owner leaves and start fretting. We want to keep them nice and still, that way we can get a nice clot formed to prevent any further bleeding.
Yep, so once the consent form is signed,
Yep.
estimated cost is given,
Yep.
we put it on the...
So we put it all on the computer, make any notes in the history for the vet to refer back to, you know, what the dog was like upon arrival if she wasn't here, how much blood, and what the owners have said, what has happened, the incident, you know, whether it be a pig wound or it went onto a fence post or something like that. Always make a note, so there's more information there.
And then what's the other thing that we make sure we update every time we have a client hospital case?
So doing their cage sheets all the time, updating that into the computer, and at the end of the day, updating, the vet will update the client. Obviously, if they ring throughout the day, then if the vet is available to speak, otherwise give them a call back. Any changes or anything like that, if the dog deteriorates or anything like that, it needs to phone call to them to let them know.
Yeah, so we make sure we've got the correct...
Correct phone numbers, that's on the admission sheet.
Yep.
So always making sure we have the correct phone number to be able to easily get in contact with them.
Righto.
So once it's in the cage, constantly monitoring for any signs of pain and discomfort, panting, you know, unwillingness to sit down in one spot for too long, and then you can adjust pain meds upon, you know, vet's instructions to suit that. IV antibiotics is generally what is given. Make sure that the dog, once you give that, you don't give it too fast or anything like that, and you don't want to make the dog feel nauseous. So monitoring IV, how fast that's running, how fast it should be running, if whether it's kinked off, because if the dog was laying like this, chances are she's kinked off that line, and just try and make her more comfortable and bring that leg out so it runs better.
Yep. If the dog was a silly dog
Yep.
and jumping up and down on the side of the cage, even though they've lost like a litre of blood and they really shouldn't be doing that, what is something that you would then do?
They may require a light sedation then, just to, you know, bring them back down to a nice normal level, just to keep those bandages still, the dog nice and relaxed, just to help form a nice clot there, rather than go back to square one if it's jumping around and, you know, moves that clot and starts bleeding again.
Beautiful.